Glad to be here.
Mhm. All right. Thank you, Pelumi. Next person, Minka in diff one.
Good evening, everyone. My name is Minka Ibrahim. I'm also very much interested in non-clinical aspect of medicine. I'm excited to learn about medical innovation from Dr. Ibrahim. I'm happy to be here. Thank you.
All right. Thank you, Minka. Um, Oluwaseun. Oh, sorry, Mirabel. Mirabel Olani. Hi, Mirabel. Are you on?
Good evening, everyone.
Good evening.
I'm just here to learn, basically, and support. Yeah, thank you.
Thank you. Oluwaseun Adewumi.
Good evening, everyone. My name is Sheung, and I'm very much interested in computational neuroscience, and which is almost outside of the medical clinical work and brackets. So yeah, I'm very much interested in this event too, and I guess I should stop here. Yeah.
Thank you, Sean. On Emore, sorry if I don't pronounce your name right. On Emore Akpewe. Are you there, please?
Yeah, good evening. You actually got my surname correctly, which is
Oh,
rare.
wow.
What am I supposed to say? I was not following the conversation.
Oh, okay. Just introduce yourself very briefly.
Okay, I'm on the very active
All right. Thank you.
I just from Georgia to this. I'm a medical officer right now.
All right. Thank you.
Alright.
Tosia Daramola.
Okay.
Hi, Tosin.
Yes, hi. Good evening, everyone. My name is Sina Dramula. I'm here to learn and see if I'm sure there's a lot I could learn from here. So, and also contribute if at all possible.
All right. Thank
Thank
you.
you.
Oyo.
Hi, good evening, everyone. I'm a doctor and I'm very interested in health financing. Currently work in both the clinical space and also in health financing. So I'm here to learn more about um, what Dr. Yekini does and just learn more from the conversational series. Thank you.
All right. Sharon.
Good evening, everyone. My name is Sharon. I'm currently working in the clinical space and I'm just here to learn other things I can do with my degree aside just clinical medicine.
All right. Thank you. Ohu Oluwaseun. Oluwaseun. Oh. All right. Dotun Shangule, you just joined. So just tell us a bit about yourself and then why you're here today.
Hello. Hi everyone. My name is Dotson Shangole, as you said, and a bit about myself. I'm a medical doctor presently doing health policy with the Federal Ministry of Health, and of course, I'm interested in health technology and ways to harmonize that with what we presently have in Nigeria. And Ibrahim has been my friend for a while, so I'm looking forward to hear the insightful thoughts he would be giving.
All right, thank you. All right, so I think we just go to Ibrahim being the last person to introduce himself. So he just says a bit about himself, and we can start.
Okay, thank you very much, Kumi, and thank you so much, everyone on the call. Um, like I'm a doctor. Um, okay, yes. So I went to med school. I'm a doctor. Finished from the University of Lagos. Then did house job like almost everybody else. Then from that moved on to public health very briefly in Lagos. And then from there, I started working in medtech biotechnology. So that's a very quick summary. So I'm not sure where to tell the distinction between the introduction and then the story.
Okay, so okay. So introduction is done now. So just a brief rundown how today will go. So for the next 10 to 15 minutes, Dr. Ibrahim will just give us a run through all his career journey so far. And while he's giving it, if we have like questions or maybe some things we want him to expound on while he's talking, then you can please drop it in the chat box. And then once we're done with that, we can address those and then we'll go into a Q&A session. So that's how today is going to run. So yeah, we can go ahead and start now.
Okay, so now I described the career journey so far.
Yeah.
So before I start, like I like to mention that when I tell the story now, it might sound like it was well planned, well thought out, like I knew what I was going to do and things like that. I just want to assure you that that is definitely not the story. Um, and it is only in looking back now, the past 5, 7 years, that I can say that, okay, I can kind of connect the story, but it wasn't well thought out or well planned as it might appear. So to really start, I'll start with, say, before going to med school, that was secondary school in Nigeria. So for me, before going to med school, I wasn't sure what was going to happen. I wasn't sure if I should study medicine or if I should study architecture. So I struggled with that for like the final 2 years in secondary school because I needed to do fine art for architecture. My school wasn't offering technical drawing, and I needed one of those to be able to go to architecture school in the University of Lagos. So eventually, when it didn't work out, I decided that fine, I'll just go and study medicine. So part of the issues then was that I didn't think about it properly. It sounded nice to study medicine. Like for most people who went to med school, I think they were encouraged from back in school that you are really good, you should study medicine. You're in science class, that kind of thing. So I kind of picked up on that too, and then went to med school. So in med school, the early years were kind of fun. I got into med school through diploma. So first year fun, second year anatomy, physiology, biochemistry, kind of fun, except for biochemistry that was, showed us Pepe at some points.
Yeah, that's
And then the pathology and all of that in 300 level were also kind of cool. And the trouble for me started when we had to move to clinical school. So it was very difficult for me in clinical school, starting clinical school, because it was then I realized I didn't really like this thing that I'm doing. And I realized that, okay, if you go to med school, you're actually supposed to become a doctor, and this is what you're supposed to be doing. So it was then I figured I'm probably in trouble if I don't find out what I'm going to do or how to deal with this situation. So by 500 level, or even before then, from 400, I started looking out for other things outside of school that I could do. And luckily for me, a year before starting med school, I stayed home for 1 year. And during that time, I learned web design, web development, things like that. So in 400 level thereabout, I started playing around with that, and I looked for a way to combine that with what I was doing. So I started thinking about digital health. So I remember then I set up um, Google Alerts for digital health. So anything digital health that comes up on the internet, so I receive an email about it. And the most important investment I also made was probably buying two books at around five. I received them in 500 level then. So one of them was the Stanford Biodesign book. It's like the Bible of medical technology innovation. Then the second book was a book by Eric Topol. I can't remember the title now, but it's something about digital healthcare. So those two books, read those two books. And since then, I started looking for, okay, who is doing something that looks like what I want to do. So then I went online, went on LinkedIn, found this guy. His name is Lawal Bakari. And I saw what he was doing at the time. And I was like, wow. I think also around that time, he just did the world record for largest number of people brushing their teeth at the same time um, in Lagos. So I looked at him and I was like, man, I think I want to be like this guy in 5 years or something like that. So luckily for me, I got connected with Lawal Bakari through CCO. I used to go to CCO in beginning of final year. So I met Lawal Bakari there. Then the main or the major turning points was then in 2014 during the Ebola outbreak in Nigeria. So Lawal Bakari, really cool guy, well-connected guy. Um, he thought to himself that, okay, the Lagos state government would not be able to handle the Ebola outbreak, especially because there was a nationwide strike at the time. There was this NMA strike ongoing at the time. So he set up a group on Facebook. He connected all the experts he knew around the world on that group chat. And then he messaged me. He said, okay, Brian, like I want you to lead design for this response team I'm setting up. So I was supposed to just design things for communications and stuff like that. So I joined that effort. It became very serious. And I remember it was a weekend before my neurosurgery posting in final year. So I had to make a decision then, like, okay, Brian, do you want to continue this thing or do you want to go for a neurosurgery posting? It was a nationwide strike. We didn't have enough patients. The fear would be that, okay, maybe long case for surgery, I would appear in front of one of these consultants and they will say, I've never seen you before. There was that concern. But at the end of the day, I just decided, man, I'm going to go and do this thing. Like, I can't do this thing twice. It can only be done once. So I didn't do neurosurgery posting. I left. I went to do Ebola alert. That's what it was called then. So, and it became really big deal to, like, it wasn't anything that any of us expected at the time. Uh, the government adopted it. We became part of the emergency operations center. We were doing really simple things then. From learning web design, I already had some friends, and I just brought two of them to Loot, to our room then in block 7 or block 8. I can't remember which one. But essentially, we were there. We created this website. Lawal helped set up this call center in one of MTN's call center. We linked all of that up, and it became the official response effort for the federal government. We were on YouTube one day or on Al Jazeera one day, and the thing we were developing in Block 7 or Block 8 in Lut then, the minister mentioned that that's the official website um, for Ebola response or communications in the country. And that for me was very surprising. Like, okay, so we can do really simple things and it can become important. More importantly was when people were running away from the isolation center in Yaba. It was through that system. It was through that system that we set up that people or that the government was able to identify people that ran away from isolation centers because they were calling through the call center. There were lots and lots of engagement. There were articles in international media also like CNN. I can't remember all the names now, but Financial Times, all of these things. So it made me really interested, like, okay, I think I like this. And more importantly, what that experience also did to me, like the first few weeks definitely was where it was the most impactful. So what that experience did to me was it made me seriously start considering, okay, um, working in public health, infectious disease control, digital epidemiology, all of these things. I had to start thinking about all of those things seriously. Like, okay, I should really consider um, maybe working in this area and learning more and stuff like that. But one of the mistakes I also made then was that by the time I was in final year, medicine posting, we had this office for Ebola alerts then in Yaba. And whenever I go there, there were these cool people. There was Lawal Bakari, there was Dayo Osholu. And whenever I go there, I remember they will scatter my brain because they were always talking about things like they could be, maybe what we'll be talking about at that moment was, okay, we're preparing this thing of like, let's talk about how we'll raise $4 million to scale to scale Ebola alert efforts across the rest of West Africa where Ebola is still a problem. So then I think we're trying to raise $5 million at that time there. So you set up meetings with like maybe the director general of UNICEF in Nigeria, and you see people committing like, okay, they've committed like $300,000, or there'll be a meeting with the medical director of FIFA. We're having meetings like that at the emergency operations center in Yaba. And I was part of those meetings. I was being given responsibility to sort out things, design programs for things like that. So when I go back to school and a lecturer is supposed to show up and maybe teach something in urinary system or end-stage kidney disease or whatever it is, and we are waiting for the lecturer, and I wait 15, 20 minutes and they don't show up, I just leave school. So I did that for like almost throughout medicine posting, most of O&G posting. So eventually, by the time it was time to write the professional exam, so it was really difficult. So I ended up failing medicine. And why I bring that up is because like for me, those were one of the things I wish I had done differently. I wish I had maintained a good standing in school and I'd not just left, or maybe even totally hacked for a year off from school and just focus on this other thing that I was trying to do. Because what ended up happening was I got an opportunity that I had been looking forward to. I wasn't sure I could get that opportunity, but I was like, okay, I'll try. And it was for a training at NASA Research Center. It was being set up by the head of Google Engineering and some other guy. So it's training you in all this exponentially advancing technology. So I got a scholarship of like maybe $30,000 for that program for 10 weeks. But the same week I learned about that was the same week I found out about the professional exam results. So, and I realized, okay, I failed medicine. So I had this week where I got this admission into this very cool program, but at the same time, I'd failed medicine and I had to figure out like, okay, what's going to happen now? So then what I ended up telling myself is that, see, the reason people are probably interested in the things that you are doing in technology is because they think you will be a doctor or they think that you are a doctor. So I had to decide that, okay, if I should leave and go for this program, that means I'll have to come back and finish med school. So I decided I'm going to just focus, get this out of the way, then do whatever I want to do after. So then I think I couldn't go for that program anyway. So I went to India instead. And in India, learned some things, learned about design, especially design physical products rather than just digital products and things like that. That's when I was first introduced to all of that. Then uh, I came back to Nigeria after that. The experience in India was very short. It was just about 1 month, but it was very intense because we had people from all over the world with varying expertise in different areas. So then came back to Nigeria, did a house job, and after doing house job, um, decided to, I mean, Lawal Bakari told me that he had raised some money for, like, based on what we did in Ebola alert, that the Lagos state government, like, he raised some money to apply that technology to notifiable diseases in Lagos State. So then I decided, okay, fine, 2017, I'll go work on that. So worked in that area, mainly trying to increase surveillance of notifiable diseases in Lagos. So that was what I was doing throughout 2017, immediately after house job. So then I learned some things from that process. I learned that I'm really not cut out for um, not-for-profits. I I have some reservations about not-for-profit. I think it's not sustainable. That's just me personally. So I feel whenever you have an organization that is mainly being funded by donations, rather than being paid for, rather than being rewarded for the value you create, there is a tendency for you to have a disconnect between the value you think you are creating and what people are actually paying for. The second issue I also had was I found out that there was a limitation in digital healthcare. Um, I felt that you can only improve processes. You can't really change pathologies. Like I was interested in being able to actually change things. Like, okay, if someone was going to die, can digital health stop them from dying? Like, if they actually had a pathology, can it actually reverse the pathology? So I wanted to be able to do things like that. So I started looking out for programs or things I could do. Then I found out about, from the book I bought in 500 level anyway. So I found out about the Stanford Biodesign program. That book was developed by that program. So I applied to Stanford Biodesign and a number of biodesign programs in America, in the UK. There's a biodesign program in Oxford. There are a number of biodesign programs in the US as well, in Texas and all of that. But the one I eventually got into was the one at the University of Minnesota. So I had a project in mind when I was coming in. So there was something I thought I would do. But eventually I realized that the idea I was working on, it was supposed to be a device for hypertension management. So It was supposed to be for remote monitoring of hypertension, developed some prototypes in Nigeria before moving here. But when I got here, uh, they took us to a couple of medical device companies. I saw what people were working on. Like the things that I expected maybe would be possible 10 years into the future, I realized that people had already done them. So while me, I was trying to think about managing or improving the management of hypertension, um, I realized that some people had already created a technology to actually, maybe in quotes, cure hypertension. Like you would basically, you can use that technology and not have to deal with medications and all of that. It has something to do with changing the, I think I shouldn't even go into the details, but essentially I realized that, okay, I need to learn things and I need to stop thinking about problems that are not so, significant. So eventually I started looking for a new problem to work on, and that's how I landed on end-stage kidney disease or kidney failure. And since late 2018, 2019, that has been my focus. Um, I now work on two projects just based on that problem. One mainly focused on the United States kidney failure market, and the second, still in the very early stages, focused on the low and middle income country market. So it's about making dialysis technology or treatment for end-stage kidney disease more affordable in this country, since a lot of people die just because they can't afford it. And that's been my focus now, and that will be my focus for the next 2 to 3 years until I'm done solving that problem to maybe my own satisfaction and I feel like I move to something else. So somehow I would say that's like a summary, that's like the story uh, of how I now got to doing what I'm doing now.
All right, thank you so much for the explanation. Like as you were talking, I think I remembered a time when I can't remember what level I was, but during that Ebola period, I remember I think I came around the Ebola alert office. And I remember like the place was actually really looking cool, but to be honest, I wasn't like aware that like such cool things like raising $5 million was like actually happening. And I'm not sure how that may have, I don't know, should I say like messed with your head? Like, yeah, people are talking about $5 million here, and then you're going back to school where your classmates are literally just doing basic things. Should I call it basic things? Like, how did you like balance that in your head to start with? Like you already explained how like you were not able to quite focus on school work so much because you were kind of distracted, and if you could go back you could like change that. But like should I say the mindset part of having to deal with this great thing and then coming
Yeah.
back to school.
I think I wouldn't really call it, I understand what you mean. And for me, I'm very grateful that I actually had that opportunity, that I had that experience. I think recently I was reading about some guy that he built a cancer therapeutics company, like he finished from Harvard, but then in his final year, that's when he started that company. He just took time off school and focused on that, raised hundreds of thousands of dollars. The company eventually failed, but then he went back to school and finished school. But so, like, I think part of the problem was that we didn't have that kind of system that encouraged you doing something else outside of school and things like that. So for me, basically, I'm glad that I had that experience. whenever I go back to school, I will just keep thinking about what they've told me, what Dio and Lawal had spoken about, what they were trying to do, or what meeting we've had, and the next steps and things like that. I think it helped me to quickly start thinking about, okay, once I'm done with school, what exactly do I want to do? So that's what that was for me.
Yeah. So can I ask a question?
Yes, you can. I think we're practically in the
Okay.
Q&A session right now.
Okay. Yeah, I just have a minor question for Yekini. Yekini has been my guy for a long time. So I just wanted to ask, I don't know the process of medical school, but you said you didn't pass medical school or you failed. So what was the certificate you left with? Because in Nigeria we are all concerned about certificate. So I'm just curious to know, did you graduate or
I see. Thanks very much for asking that question. So in med school, we have two exams. So like for every year, you write the exam at the end of the year. So for every year, you have a first exam. If you fail that first exam, so you add a receipt. So I failed the first exam, but then I had to do the receipts. So part of why it was painful for me was like I could have gone for the program that I always wanted to go for, but then I had to wait like I think a few more months. I can't remember the details. I eventually finished med school in June 2015. And I can't remember when my mates finished, but I know they finished earlier, maybe a few months earlier. So that's what I meant by that.
okay. Congratulations on your successful completion of med school.
Thank you.
All right. All right. Thank you for that. So someone sent a question in. Person wants to know if biodesign is different from artificial intelligence in medicine.
So I would say Biodesign is just mainly, I will call it, say, innovations in healthcare. So the process is basically the process of bringing new technologies to market. So artificial intelligence is mainly, I'm not qualified to talk about intelligence, but I know it's just one area in mathematics and computer science. While biodesign is mainly focused on, I don't know what technologies you use in the hospital today, syringes, they're wearing always syringes, the process of creating that technology, bringing it to market, or the Kalman syringe, for example, for um, performing what you use it to perform. So those kind of technologies, or whatever new technology becomes, commonplace. Even things like the imaging devices, linear accelerators, MRIs, things like that. The process of creating those technologies is what biodesign is. So there is a long process that involves first doing just being in the clinic, and that's why working in the hospital is useful. Understanding what the problem is, how it's currently being solved. Then there's another process that involves thinking about the market. Like if you create a solution to this problem you have found, how much could investors potentially make? Then there is the process that involves then creating the solution. After creating the solution, there's a part that involves testing the solution. You do a bunch of experiments. Then after that, there is regulatory, dealing with the FDA in America or the equivalent of that in Europe or other parts of the world, before eventually then doing a clinical trial. It's usually a long process. If you complete a technology within a space of 5 years, it's usually thought of as fast, successful. So most people that I know have worked on things that are taking 10 years. One of my mentors worked on something that took 20 years. So, but when they do those things, when doctors start making use of those technologies, you really don't think about them as a doctor. It's just in your books. and it gets used for years, for decades. So, but the process of bringing those things to market is what really biodesign is.
Yeah, that's quite interesting. I thinking about that, I know in Lutz there is a bioengineering department. Is it kind of like similar to that? I'm thinking that is kind of what biodesign is, but I don't know. I don't know what the curriculum of Lutz bioengineering department is.
So I'm familiar with the biomedical engineering department in Lut. I actually know the head of department, and so he also did a biodesign program, but he did the biodesign program in South Africa. So there's a biodesign program in University of Cape Town. So, but biomedical engineering basically is applying principles of engineering to solve biomedical problems. So if you, for you to be a biomedical engineer, you could be a chemical engineer, an electrical engineer, a mechanical engineer. But whenever you apply those principles specifically to solve medical problems, and that's biomedical engineering. So that's kind of what they are trying to do with that department in Lutz in Unilag. It's still at the very early stages, but that's like a step in the right direction.
All right, thank you. Another question from someone is okay, so for a colleague who is 2 years post graduation, just starting to learn HTML, not sure where this is going to lead to, but he just knows that he's happy whenever he learns about computer and technology. Like, what advice would you give the person?
For me, I would say that, like, first thing is to, it's very useful if one tries to get some sort of formal education in that area. It helps, especially because at the end of the day, there is passion, but there's also the need for income. Like you need to earn money and things like that. And I mean, like if you already earn enough money being a doctor and you're fine with that, maybe that's cool. But if you feel like that's the main thing you want to do, it might be difficult to compete in this day and age with people that have already been, I mean, I think it takes about 1 to 2 years to learn this HTML, CSS, or web programming technologies to a point where you can start earning some money with it. I mean, I'm not sure how much time one has to be able to do that, but getting a formal education, like for instance, now I feel that I wish that maybe I had known things that I know now early on, and maybe I had started a degree immediately after I was done with med school, like just immediately start a degree, in the area that I'm trying to gain experience. So I think that's one thing that I would advise.
All right, thank you. Um, okay, one question just came in. So, first question is, how do you convert your ideas to reality? Like, so from the idea you have in your head to something physical. Then, okay, so I think I should just call two questions at once. So, the second question also has to do with ideas. So, thing is, how do you get people to invest in your idea without them stealing probably like IP rights for that said idea? So maybe you're pitching your ideas to companies, and then obviously they have more money than you. How do you protect yourself from sharing this idea mistakenly with them, and then they tell you they don't have money to invest, and the next thing you see them launching your products?
Mm. Thank you very much for that question. Um, so I first thing I'll say is like okay. So how do you convert your ideas to reality? Look, in my own experience, so I'll use the first technology I worked on, and that I'm still working on here as an example. So it's something for reducing infection in dialysis patients in America. So for people that perform dialysis at home, so it's a technology for reducing the rate of infection in those patients. So the process, when you first think about this thing, I'm not an engineer. I don't have an engineering background. Like I could only, so the first thing I tried to do was sketch what I was thinking about a lot. The next step was using simple things like papers, boxes, cardboard boxes, things like that. Like we call it a kludge here. Like you just kludge something together to help people to visualize and play around with what you are thinking about and what you have created. Then the next step, and the next step to that, and I get the concern about ideas being stolen. And I think that's how things are a little bit different here because there's a culture of intellectual property protection. Here in the center where I work, I think there's that culture generally in the US. So one of the things they trained us to do is how to file um, patents. So it's basically an intellectual property protection. So the moment you come up with something, when I started my fellowship, I was given an inventor's notebook where whenever you think about something, the first time you think about it, like you have to talk with someone, explain that idea to them. If they get it, like you sign in a document where it says you came up with this idea, it's yours. We worked with lawyers, and I know there are also intellectual property protection lawyers in Nigeria. So it's just that a lot of people don't make use of it. But those are some of the ways you try and protect the idea. I think for me, part of what I've learned is people don't really want to steal, at least in my own experience. It's not like people really care about stealing anybody's idea, like, especially in this industry, because there are so many ideas, but you are not sure it will work. Before you know if something works, maybe it might take like 5 years. So if that's when people might not steal the idea, then they could throw money at you, but I don't think they don't really go, and there are always ways to get around an idea if it is good. So, but okay, so I'll just move on to something else, which is how do you make it a reality? So a lot of what I did was work with people that understood things that I did not understand. I worked with like a bunch of mechanical engineers, like at the very early stages of the technology. And I also looked for very small funds at the beginning. At the start, I was looking for funds of, I was first doing things that I could do myself with like less than $1,000. Then it moved to a stage where that small amount of money helped develop the idea, develop the technology better. It got to a stage where I could apply to about $20,000 comfortably. And it got to a stage where I could apply to like $50,000 comfortably. So those small amounts of money continue to build the idea. Most recently, like for that technology, and after partnering with more experienced people, we're at a stage where on the same technology in 2020, we got like more than $300,000 for that same idea. So it's, for me, it's about working with people because you don't know everything, no matter how smart you think you are. The second thing is taking advantage of intellectual property protection that is available, and you can protect the intellectual property. It can be expensive, but it's available. You can do it in Nigeria. I'm very confident about that. You can do it, anywhere you are in the world as well. And some of the things that makes sense to do is, for instance, for me now, like that technology, I'm the inventor, but I'm not the owner of the technology. It belongs to the university because it's really expensive to pay lawyers and do intellectual property protection properly. So they pay for they pay for the intellectual property protection. They've probably the first time they paid like maybe close to 5,000. At this stage, because I think they filed internationally, they've probably paid more than $20,000 or maybe close to 20,000. And as they progress to maintain it, they might pay up to $100,000 to protect it in as much places as possible. I don't have that kind of money. Most people don't have access to that kind of money. So working with an institution makes a lot of sense. Um, I think somebody says something that the best way to increase the value of what you have is to give it away. If you try to be the owner of everything, if you don't allow other people get on it with you, progress will be slow. Things won't get better as fast as they can. So that's the way I'll think about that.
All right. Thank you very much, Ibrahim, for that. That was quite insightful. I just wanted to mention that we can also like unmute to ask our questions. If we don't necessarily just have to type it in the chat box, we can speak up so that we have other voices here. Is there anybody that wants to ask a question at the moment? All right. So, Christian.
Hello.
Oh, wow.
Good evening.
Oyo.
Okay, good evening, everyone. So, my question, thank you, Dr. Yakini, for sharing your story. I think it's very interesting. And I think one thing you said that I really picked out was how you said you did not exactly plan everything that has happened to date. So, in a way, it's been maybe a bit of just going where the journey leads as well, even though you're putting in the work. So, I wanted to ask about something. I think for a lot of people that want to delve outside medicine, it tends to come up. There's a part of pursuing your dream without, say, any cushion, so to speak, versus trying to fund that dream. Like, in a way, clinical medicine offers some relative amount of stability. Well, at least most of us are doctors here, so we know it may not give you millionaires money, but it gives you some comfort or some stability. And the world outside of clinical medicine just looks scary, honestly, for a doctor in training. So what's your own take on pursuing your dreams immediately versus trying to gain that financial cushion slash funding to fund your dreams? I, I just want to know what you think about it.
Yeah, thank you very much for that question. I think about it in two ways. First, like I would just consider this area, I would say biodesign, biotechnology, for instance. So um, if I knew that this was what I wanted to do very early on, and it was clear to me, like I could easily just like all those very early years during a house job, all those things. I could just have taken that time and gone to do a graduate degree straight. And after doing a graduate degree, you can just be working in that area. Like if you didn't study medicine and you studied like maybe a general engineering course or something that is not a doctor's degree, like if that's the only thing you want to do, you could just easily do that and you will live well and you will be okay. The challenge, however, is that like most of us don't, end up finding out or we don't realize early enough. So in that situation, like, I mean, it really depends on the person. For some people, they are fine with, being, for some people, they are very okay. They are fine with staying in medicine, using their free time to learn the next thing they want to do and eventually moving. I know a number of people that have done that. They stayed in medicine and they used their extra time to do something else. And when they were comfortable, they made the move completely. When they realized that, okay, now this thing that I'm doing can now pay my bills properly. So they made the move. So for me, like I mentioned, this area that I'm in, like you don't want to jump into conclusion. Like maybe in my mind, I have a figure like I want to be able to make every year. And I would not say, so what I'm doing basically is I'm not going to just say I'm going all out, I'm never going to work again until I am completely assured that what I'm working on is successful. And it takes some time to be able to tell if it's successful. We've not even, for what I'm working on, we've not even done a clinical trial yet. It's until you do a clinical trial and you see the results that you can assume that you will make significant amount of money off it. So until that point in time, what I'm just doing for myself is um, I'm working I think I'm kind of lucky because I'm able to work on what I want to work on and at the same time get paid. I understand that that's not the situation for most people. But what I'm doing is I'm keeping my options open basically. Like, okay, if this doesn't work out and it could potentially not work out, so but I'm just trying to prepare myself in such a way that 2 years from now, the experience I've gained, all of that can still be transferable. I can easily work in a company. Like as I am right now, I started a degree, a part-time degree on the side in biomedical engineering at the beginning of 2020. So like while I'm working full-time, I'm doing that on the side just to make sure that you don't box yourself in because it takes time to, at least in this area, it takes time to find out if what you are working on is successful or not, and it's risky.
Mhm. Thank you, Ibrahim. I think that answered question. All right, Oluwatosin, you can ask your question.
Thank you, moderator, and thank you, facilitator. It's actually my third question was not answered, so that's why I raised my hand up.
Okay, it's fine. You can ask it. You can ask it.
I think I see the question.
Yeah, I saw the question, but I thought maybe she wanted to like say it herself. Okay, so the third question was, let me go back down. Okay, so how easy is it to get postgraduate education outside the country with a background in medicine and surgery, especially when you didn't take the prerequisite maths courses?
Well, so it depends on the specific area you're trying to get a postgraduate degree in. For me, I guess it was easy to get admission into biomedical engineering, even though I didn't take any maths prerequisites or without any engineering background, just because of the kind of things I've done and the area in which I've worked. I also know of, and doing biomedical engineering is not the only way to get into the field. People get into the field with an MBA. You can basically do an MBA with anything. So people get into the field with um, degrees in biological sciences. I had a friend who, um, if she wanted to work in biomedical engineering now, she could work. But I mean, so she just came, she finished medicine and surgery, came to Minnesota, did a degree in biological sciences, worked on hypertension. She learned how to do experiments with, so the kind of skills you need is what matters. People do MPH and eventually branch into this industry. So they do epidemiology, learn how to design clinical trials. Those are the kind of skills you need. So if you think about the entire value chain, there are many areas or many points where you can pick something you want to focus on. It could be designing clinical trials. It could be, the engineering aspect of things. It could be the testing or the experiments and things like that. So it could be any of those areas, and you'll be able to eventually get into the industry.
I think that answers the question. All right, so there is one last question. Probably after that we can take one more if there is any. So the question is asking if at any point you miss clinical practice.
So there's something that happens, which is like for me, I've had a very weird relationship with clinical practice. So like I mentioned in the very beginning, I found it very depressing. The only thing the person I enjoyed the most from med school was surgery. The surgeons seemed to be different. Doing house job, I also enjoyed O&G. So I've played around with the idea of, oh, maybe, can you hear me?
Yes, I can. I think others can as well.
So I played around with the idea of, say, practicing medicine clinically. And that comes up when maybe I'm in the hospital during during clinical immersion for my project or things like that. But for me, what I just think about medicine for is I think about clinical practice like maybe like an edge. I'm not sure how other people feel, but like for some of my friends, they really don't care. Some of my friends who have moved away from clinical practice, they really don't care and they feel like I don't think about it. For me, I think about it from time to time, and sometimes I miss it. But at the end of the day, I realize that, Ibrahim, you cannot do everything. And if you have to choose, like, if you have to choose between these two, which one will you choose? And I know that, okay, what I'm doing right now is what I would choose. Maybe if I was wiser, if I had my way, maybe I could choose both. Maybe that's possible. Some people have been able to do that successfully, like choose both in these areas. But there are very few people like that. But that's something that's possible. But yes, answer to that question will be like every now and then I miss it, but at the end of the day, I can't do everything. Why can't I hear you?
The host is on mute. Unmute yourself.
Sorry, I was muted.
Okay, now I can hear.
All right, sorry about that. So Martin's has hands up. So I think this will be our last question before we like round up. Martins, you can go ahead and ask your question. Hi, Martins. All right, seems he's not here. So do we have any last questions? Anybody?
Oh, you can't hear me, right?
Okay, yeah, I can hear you now.
Okay, I'm just asking that did you start degree all over again, or you just go for MSc in biomedics? And how about funding? Do you get a scholarship, or how easy was that? Like funding the the program, the biomedical program. Is it a degree or an MSc program?
So the thing I did is actually a fellowship. So it's almost like doing the same way you do a residency here, where it's not a degree, but it's like you're working, but you're being paid. Do you understand? Like when you're doing a
Okay,
residency
yes,
where you're working exactly. So the bio design programs I applied for and the one I eventually got into, that's exactly what it is. You get a certificate of some sort at the end of the training, and that's what I got. But it's not a degree.
Okay, thank you. Thank you.
You're welcome.
All right, thank you, Ibrahim. I think that's all the questions we have. This was actually quite interesting.
The
Hello?
host is
Okay.
introduced himself. We don't know much about the host. We know much about Yekini, but we only know as steps.
Oh, okay. I introduced myself at the start. So I am Olakumi Oguyemi. I am also a medical doctor. I think 2 years post graduation now. My interest.
Terry, please, can you speak louder? We can't hear you.
Oh, okay. All right. Can you hear me now?
It's not
Very
as clear
low.
as before.
Hello. Can you hear me?
Yeah, but it's still not as clear as before.
Oh, I'm not quite sure why that is, but I'll probably move the mouthpiece closer. So I said, Ola Ogemi, and I'm currently about 2 years post medical school right now. I am obviously interested in aspects of medicine or at career paths that typically don't involve stethoscopes, the typical theater, clinic, and all of that. And I think this is like because a good number of us have these issues. So for me, I'm not particularly interested in bio design or biomedicine, even though it's a very interesting field. And at some point when I was battling the whole medicine or engineering thing, I was like, oh, bio engineering may not be so bad because it's like combining both. That was my secondary school mind. But at the moment, I'm more interested in health economics, health policy, and we'll probably get people to talk on that as well as we go ahead. So I don't know if that did a good introduction.
Yeah, I think that should suffice. Yeah, thank you very much for answering the simple question.
All right, thank you. Thank you, Baba Bande. All right, so I think we're at the end right now. Ibrahim, do you have any, like, should I say last words for us just before we close?
I didn't think about last words.
Ibrahim.
I didn't realize
What's it?
last words. I didn't realize last words were a thing.
Okay, like, okay, just something like, okay, if there's one thing we should leave with, just one or two things that you would just like to close with, because we're practically at the end right now.
Yeah, I think the most important thing is almost like what I said at the beginning, which is for anybody, it doesn't look straightforward. Like it doesn't look straightforward when you're in the middle of it, when you're in the middle of the journey and things like that. So whatever you're doing, I mean, you're looking out, you're going to listen to people that are talking about other things outside of medicine, you are doing things here and there, you are probably going to end up well. You are very likely going to be fine. You are doing all that you can do, but it doesn't feel like that in the moment. And it's always that way, at least in my own experience. It is when you look back and you think about what you were doing, when you look back 5 years, 7 years, 10 years, then you then realize like, wow, that actually made a lot of sense. So that's what I would say. I doubt that anybody has it figured out immediately, like, oh, like, I don't know who has a plan. Maybe there are people like that, and they plan 10 years into the future, and it's exactly like that. I don't know if there are people like that, but I've not met any. So I just wanted to repeat that again and say that again.
I think that's actually quite helpful because a lot of time, I think when you start seeing people like probably working in what you think is like their dream field, it kind of seems like, oh, there was a plan. And while I think like, yeah, it's good to plan and it doesn't make sense to just live life without planning. As you said, most times things don't go like on that straight line, then it because
Exactly.
All right. Thank you very much, Ibrahim.
Thank you so much, everybody. This was really
All right.
fun. Thank you,
Yeah, thank you.
coordinators.
All right, so please, you guys, you can follow Dr. Zital Stats on Twitter and Instagram at DW Stats, and also on LinkedIn, Dr. Zital Stethoscope, Dr. Zital Stats rather. So just so you can get more information about other programs, and you can also like tweet at us or DM like suggestions of what you would like to see from us, people you would like to come on here to like also talk with and interact with as well. Thank you all for joining. I think we're at the end right now. Have a lovely weekend. Thank you, Brian.
All right, thank you.
That was quite nice. I enjoyed it.
Thank you.
Best London 1 hour in the world.
And then okay, you joined in as well. Alright. Sorry, Brian. I think I should actually have thanked you first before I thanked everybody, but like
No, that's not a big deal. I'm sending you something.
All right, yeah, I'm seeing that.
All right. Where?